Traumatic injuries are often at the center when there are mass casualty events. So what role has trauma played as we endure this pandemic? I'm joined by Dr. Jonathan Gates. He is the chief of surgery for Hartford HealthCare. Welcome. Have you seen many trauma-related incidents during this pandemic?
Well, thank you for having me today. Anytime there is a pandemic, we know from history that the number of traumatic injuries tends to decrease, and that probably is more of a reflection of the social distancing, and people are less active and less out there in the community. So from the trauma standpoint, we are still seeing patients, and it's just a fewer number, which is what we would expect.
Now, I know
I think that we are still able to take care of the trauma patients, even though we have an influx of patients from the pandemic. There's certainly, have all capacity to take care of trauma patients when they do come in.
And that's important because I know people will say, oh gosh, I can't go to the hospital right now. It is still safe, and you have a way of dealing with people who are non-COVID related.
Oh, it's very safe. In fact, we are very much set up to be able to take care of patients. And as you know, when patients come in unidentified or with unknown injuries, in some ways in this environment, we have to treat them as though they have COVID until proven otherwise. So we have a certain area of the emergency department that we use, and all of our healthcare members are taking precautions to prevent any potential contamination from a coronavirus. And we are then able to take care of those patients and move them through the system as we normally would for any injured trauma patient.
Police have reported a rise in domestic violence cases since the self-isolation. Are you seeing that?
You know, I do know the police department from Hartford had released that data. And I would say we have not. We occasionally will see, interpersonal violence and continued, assaults and things like that, which occur.
So if you want to give some advice for people who are listening, how can they avoid trauma-related injuries? I know some people are trying to do things they've never done before around the house.
Well, I think you have to be careful about that. Clearly, we do want people to be active as they can be, but respect the social distancing and wearing their mask, and but trying to get exercise and trying to stay healthy as they can. It isn't a time when people have to hunker down and can't do anything, but I think they just have to be careful about doing anything they might not be familiar with, and certainly if they do need to go out to provide groceries and other things for the families, they just have to be careful about doing it. And again, in the event that there is an untoward problem, we are here, and we are more than capable of taking care of any of those injuries that might occur.
Dr. Gates, thanks so much for your time today.
Thank you very much for having me.